Hi guys, Michelle here with Lumen Massage. Today I want to talk with you about postpartum care, specifically postpartum care relating to massage therapy for after you give birth as a mom. So I just want to share with you some of my experiences, especially when it comes to dealing with scar tissue and C-section recovery. A lot of moms ask me when they can come back to get a massage after they give birth. And if you have a C-section, it is considered a major surgery, and about 4 to 6 weeks is the usual time span for all surgeries, really, to get clearance for a massage. But yeah, 4 to 6 weeks is pretty much the time frame that you're looking at, and you can continue receiving your massage and transition from prenatal massage to now mommy care or postpartum care. I also want to let you guys know that postpartum care lasts for a really long time. Some people think it's directly after you give birth, but that's not the case. You're dealing with your hormones, a lot of changes in your body, not to mention physically your muscles are just really tight, whether you gave birth naturally or whether you had a C-section. But in this video, I really want to talk about, as I mentioned, C-section and postpartum massage and what that looks like. So after you've scheduled your appointment for your massage therapy, you really want to take a look at your belly for any swelling. Some of you may not feel comfortable sleeping on your belly just yet, but for the most part, after about 4 to 6 weeks, even with a little bit of swelling, you should be okay unless the stitches have come loose or there's tearing or there's abnormal bleeding. But if everything looks clean and the incision looks like it's healing nicely, laying on your belly or laying in a prone position during your postpartum massage should be absolutely fine. Feel it out. If it doesn't work for you, your therapist should be able to accommodate. The best way to accommodate is simply to lie in a sideline position, which is basically in a fetal position. So very similar to what you would do in your prenatal massage. You're going to lie on your left side, your right side, and you can lie face up. That is if your belly is swollen and it feels uncomfortable to be face down. But again, after about 4 to 6 weeks, you should be fine. The other thing I wanted to mention is, should you work as a massage therapist around the belly and around the incision? And the answer is yes. With the mother's permission, take a look at the incision and make sure that there is no pus or infection. Moms, this goes for you too, or dads if you're watching right now and you're interested in getting your spouse or the woman you love postpartum recovery massage. You're going to take a look at the incision and make sure there's no infection or anything that looks abnormal or strange. You don't want to tug around the incision too much, but you can definitely do light massage. You can do some lymphatic drainage. Basically, lymphatic drainage is just working around the area, around the incision, to reduce swelling. Now, why is this important? Not only are there physiological benefits to working the incision, but there's also a lot of psychological benefits and emotional benefits. Why is this the case? For many moms that pursue massage therapy, they prefer a natural birth, and that means a C-section wasn't necessarily planned. This might bring on emotional disappointment, and having a scar might be a reminder maybe of how they failed as a mother. Again, this is not the case across the board, but it might be the case for you if you're a mom watching and you were forced to get a C-section unexpectedly and you had envisioned in your mind that the natural birth is the way that you would go. First, I want to assure you that you are a fantastic mother, whether you had a C-section or whether you had a natural birth. But back to the massage. What massage and bodywork does for scarring or incisions or post-operation is really, really special. I feel like it does something that no other medical discipline does, and it really brings compassion back to the area and a ritual of acceptance. So basically, when you are touching the incision and when you are having someone else, with permission of course, go ahead and massage the area. Basically, you're acknowledging that, which is very powerful. because it really allows you to kind of accept what happened to the incision area. And that is really, really a part of the healing process. You, along with your massage therapist, can really start to walk through that healing process and really accept what happened. Again, whether the C-section was planned, but especially if it wasn't planned and it was seen as something as a surprise. So that is something that I highly recommend. Of course, please take the precautions that I gave you. Take a look at the incision, make sure that it is healthy and clean. But if it is and there's nothing of concern, you can work around the area, because the muscle tissue and the fascia in the surrounding area need just as much attention. You can lightly touch the incision area if it's safe and if the mother approves. That's also part of the healing process as well. Anyways, guys, I hope that this helps. It's a short segment on postpartum care for mothers that just gave birth, but it's very, very special, and it's a unique contribution to be able to help a mother heal during her C-section and her post-op in massage therapy. If you have any questions, please feel free to leave a comment below. If you like this video, click on the thumbs up and remember to subscribe. Thank you so much, and I'll see you in the next video.